Es como el Necaxa y el... ¿Cuál es el otro equipo? El América. Se pasó al América ahora. We're ready? So now, hello everybody. So we have a very nice case today. I would like to share with you this case. This is a 58 years old male with history of dysphagia. Recently, ¿cuánto tiempo de disfagia? No, 1 year of dysphagia. And this patient have a big lesion that was observed at CT scan and was sent to us to perform an EUS. So you can see the lesion. The lesion is a cystic lesion that is occluding completely the esophagus. So that's why it's the dysphagia. But this is not, I have my needle here, and this is coming from the wall, from the esophageal wall. So one of the one of the possibilities is a collection because this patient had already a surgery. ¿Cuántos años? 2 years. 11? No, 11 years old. 11 years ago. So I don't believe that it's because of the surgery, but there are some surgeons here that say that sometimes could appears that no, sometimes could appears because of accumulation of ¿cómo decimos saliva? Well, saliva, saliva, saliva. Okay, well, so the surgeon says that, but I believe this is not saliva. I believe this could be more bronchogenic cystic lesion, and it's a big lesion. You can see here. I will try to um, I will try to be to show you a little bit. So I already do some description of some cases with this like start sealing. So when you see something like that inside, and this is a very very density solution, high density solution, it's not easier because I do aspiration with the needle, with the standard needle. I am using a 19 gauge needle, and nothing is coming. And at the same time, I try to do an aspiration with the aspiration of the scope. So this lesion is really big, and now this patient is symptomatic. Normally, we don't do nothing with this. It means we don't treat this kind of lesions, but in this case, it's necessary, as I already mentioned in my publication many years ago. When you have symptoms like dysphagia, you need to treat that. So that is what we will perform today. So I will do, usemos uno de 10 por 10. Okay, so I will use an Axios 10 by 10. I will do a drainage. This is a very nice case, a very beautiful case. So I will retire my needle, but at the same time, I will try to... Saquemos el líquido para ver qué es lo que hay. Pongámosles en algo transparente, no sé. So I will see what we have inside the needle. So you can see mucus normally. So there is no vessel, involved in this needle, in this lesion. And this is a big lesion, so this is why the problem. So this is not a solid lesion. You can see. Really nice case. Okay. ¿Hay algo no? No. So we will see if this is mucus. This will be a bronchogenic cyst. It's my first time that I have to treat that. No pasa nada. It looks like mucus, but what do you see? This is not wide. ¿Qué es? ¿Será moco? No creo. Pruébalo. You have to try. We need to try, like all physicians. ¿Qué es? Parece sangre, ¿no? It doesn't smell nothing. Okay, so I will use an Axios 10 by 10, and then I will use a standard scope to do an aspiration. So I believe it's a bronchogenic cyst. It's most common. Pero la saliva de ese color. I am inside. The Axios is open. So now we open it. Oh, it's mucus, huh? So this is a bronchogenic cyst. However, this patient doesn't have, too much um, uh, symptomatology. Not asymptomatic. Not cold. Normally they have cold, but this patient didn't have it. At least, he's lying to us now. But it's a really nice case. So now we need to do an aspiration. I will not use the ultrasound scope. No, dije un estándar, normal. Necesito dilatar. So I will do a dilation until 10 millimeter and I will use a standard. Oh, no, 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 no. No, no, dame el, perdón, dame el que me ibas a dar. Sí, porque es de 10 milímetros el Axis, no es de 15. I will use a nasogastric scope to do an aspiration. So we will relieve that. Vamos a ver la imagen endoscópica. You see? Mucus. Mucus is coming. A lot of mucus. You see? Huh? So there is a risk of infection, so we need to do prophylactic treatment with antibiotics, for sure. But there are some cases already in the literature that show it how to treat, drain this kind of lesions. Huh? Very nice case. Huh? Oop, oop. Necesito hidratar. Dame un balón de hasta 10, 8, 9, 10. 2.4, déjame ver el balón. Si entra. Sí, 2.5, no, no entra. Entonces necesito uno de menos. 6, 7, 8. Ok, dame una guía. Vamos a pasar por aquí y pasamos el balón por los lados. So I am using a pediatric, scope, so I cannot use the balloon for dilation. This is very important. So what I will do is to pass a guide wire inside. No me hago, perdón. I don't see nothing now. Well, we're inside now. Okay. So it's very important to do a dilation and to go inside and to do an aspiration and finish. After that, you can less the axis just 1 week to see if everything is okay, and then we can see. And then we can remove it. So that are the steps. ¿Qué pasa? ¿No sale la torre endoscópica? ¿Se vio la imagen endoscópica o no? I'm sorry, my technicians, we have a punition today. We are not looking exactly what I am doing. So I left the guide wire. Let's see. Ok, tienes que tener la guía por abajo. No te preocupes. No, necesito que sostengan la guía. Well, let's see, huh? Where I am. Let's see. Cuidado. Cuidado. Cuidado las alas la guía. La verdad es que... Bueno, yo creo que se te viendo la guía. No, yo no la veo acá, mira. Ah, no, ahí está, ahí está. Está en la guía. So now I am passing now. So you can see the endoscopy view. You can see the balloon. So the idea is that if I am correct, balloon will go inside the axis. Oh my god. Yes, we are there. Okay. So now we are inside with the balloon. Tengo un poquito la guía. Very good. Ahora sí dilata. No. Now we will do a balloon dilation until 10. So I'm flushing with water to see better. Huh? Water is better. Picture. Up. ¿Ya estamos a 10? Okay. Desinfla. So we do the dilation, and now we know we will go inside the cystic lesion. You see? Very good. So now it's raining very well. So now I will go inside. It's very heavy, the fluid. Even with this 2.4 millimeters, it's difficult to do an aspiration. Huh? This is a bronchogenic cyst. You see, there is a wall. It's very, a lot of mucus. Why I say it's mucus because it doesn't smell nothing. Very good. We're inside the cystic lesion. You see, very well. It likes good, huh? It likes, but it looks well. It's okay. So we're ready, huh? Oh my God. Very good case, huh? Okay, we will cut the transmission. Thank you so much. Gracias. Nos esperamos otro día por la misma hora y por el mismo canal, como dicen en México. ¿Ah?